Well, I think that we should go back to the drawing board and accept the fact that healthcare is expensive. Two, we should accept the fact that we need to prioritize healthcare as a people. If you look at all the indicators, we are nowhere near the percentages of our GDP that we ought to allocate towards healthcare provision, whether at the ECOWAS or West African level, the global level, and what have you. So we need to double up our efforts and make sure we do the right things. There are also gaps that exist beyond the funding issues, be it at the professional level, be it at the institutional level. The systems ought to be improved, and it takes deliberate action. Three, the costs that may inure or come to the way of the potential patient if we don't address these problems properly will be what I talked about earlier, i.e. the defensive medicine and the associated costs. Beyond that, we also need to understand that malpractice itself, as I stated, is something that is woven into the practice. If you go to the developed jurisdictions where they have all the facilities, malpractice issues exist, and we report on daily basis.
Right. Doc, the way you are saying this calmly, it feels as though they exist, and so it's okay, it's normal.
No, I'm not saying it's okay.
You're not saying that, but
we
how it's coming across to me.
Hold on. We need to understand reality. Let's say if you are a footballer or in the sport of football, injuries will happen. Okay, that is what I'm saying, that if you look at medical care or the healthcare systems the world over, issues of medical malpractice will one way or the other come to the fore at some point. But that does not mean that we cannot address the underlying issues that contribute to higher numbers.